Then so
Okay.
you'll press that, and then when we're done, you'll go back and make sure you click end recording.
Okay, very good. Okay. You're awesome. Thank you so much for helping me with this. It's been forever since I've been
Yes.
in school. I'm clueless. I really am.
You're
Okay, so
fine.
we'll start now, okay?
Okay.
All right. All right. Okay, I'm just going to start. Hi, I am Miss Diamond and it's nice to meet you. Your name is again, I'm sorry?
My name is going to be Gail.
Gail? Hi,
Mhm.
Gail. Nice to meet you.
Nice to meet you too.
Um, if it's okay with you, I'd like to ask just a few questions that will help me give you better medical care. The questions relate to your experience with alcohol and other drugs. Some of the substances we're going to talk about are prescribed by a doctor, like pain medications, but I will only record those if you have taken them for reasons or in doses other than prescribed. I'll also ask you about illicit or illegal drug use, but only to better diagnose and treat you.
Okay.
Okay? All right. So this is pretty short and sweet. Um, it's very just it's three questions. The name of the screening that I'm using is Audit C, capital AUDIT, comma or slash C. And I don't know if we're supposed to tell them that or not, but I'm just telling you anyway. Um, so it's only three questions, and I'm going to start now with the first question is how often do you drink? I'm sorry, my glasses. I don't have my contacts in. I'm wearing my glasses and they're not very good. So how often do you have a drink containing alcohol? So there are five different choices that you're going to answer. A is never, B is monthly or less, C is 2 to 4 times a month, D is 2 to 3 times a week, and E is 4 or more times a week.
I never have alcohol.
You never do. Okay. All right. So my next question is how many standard drinks containing alcohol do you have on a typical day? You just said you don't have any alcohol, but I'm still going to repeat the answers for you. A is 1 or 2, B is 3 or 4, C is 5 or 6, D is 7 to 9, and E is 10 or more.
I don't have
You
none
don't.
for me. I don't drink
You don't
any
drink. Okay.
alcohol. No.
Okay, well, I'm just going to finish this third question, even though I'm pretty sure I already know what your answer is going to be. How often do you have six or more drinks at one occasion? You've already said you don't drink, so I'm going to assume your answer is going to be A, never.
Yep, that's right.
Okay, well, that's very good. We are going to move on to a second screening tool that is called the CRAFT screening tool. It's CRAFFT.
Okay.
And we'll go through this briefly for you, and we'll see what we can do for you from here.
Okay.
So the first part of uh, this screening interview is I'm just going to ask you a few questions that I ask all my patients, and I would like you to try to be as honest as you can. And I'm going to keep everything you tell me here today confidential. Um, so during the past 12 months, have you drank any alcohol more than a few sips?
Um, no. I just do
No. Okay.
marijuana.
Oh, okay. So that's my second question. Did you smoke any marijuana or hashish?
Yeah, I smoke pretty often, just about every day, whenever my mom is not on my case about it.
Okay.
But even then, I
Okay.
still sneak and do it.
Okay. All right. So do you use anything else to get high? Anything else is including illegal drugs, over the counter and prescription drugs and anything that you sniff or huff?
No, I take medication for my depression, but that's not something that like abuse.
Okay.
Um, but I do take that with like smoking marijuana
Okay.
too.
Okay, I understand that. Okay. All right. So then I'm going to go ahead and go on to part B. Um, to this screening interview. The first part is number one is have you ever ridden in a car driven by somebody, including yourself, who was high or had been using alcohol or drugs?
Yeah, my dad recently visited, and he's an alcoholic, and so my mom made us stay with him for like a week, and he like was drunk the whole time. So I'm pretty sure
Oh,
he was like driving while he was drunk, or at least had a couple of drinks. But I guess maybe he doesn't care about it, like he's so used to it that maybe it doesn't affect him as
oh, I
much.
see. I see. I understand. Okay. Thank you for sharing that. Do you, let me see. For number two, I'm going to ask you, do you ever use alcohol or drugs to relax or feel better about yourself or to try to fit in?
Not to fit in. I do it to feel better. My
Okay.
mom's pretty crazy and she says a lot of mean things. And plus I have depression and I just feel like sometimes I don't look the greatest. And so I usually smoke just to make myself feel better and to get away from my family. My mom is psycho.
Oh, I'm sorry to hear that. Okay. I see. I see. I see. Okay. Um, so do you ever use alcohol or drugs while you are by yourself or alone?
Yeah, I smoke quite a lot like when I'm in my room, but like my mom doesn't know that, but like I sneak and do it. But
Oh,
I
okay.
also do it when I'm with my friends too, and sometimes like I'll hide my weed at my friend's house that my mom doesn't
Oh,
catch it.
okay. I see. Okay. All right. My next question is, do you ever forget things you did while you were using alcohol or drugs?
Um, no, I mean, my mom like knows about me smoking, and there's not really much she can do to stop me. I mean, she's like gives me drug tests and stuff, but I normally do it when I'm by myself. Or like if I
Okay.
do it with my friends, I don't do anything like super bad, I don't think. Like maybe hide it so that my mom doesn't find it because I don't want to hear her mouth about it.
Oh,
Um,
okay.
but like I don't
Okay.
think I do anything like super bad besides for smoking, but like
Okay. But you're not unforgetful. It doesn't make you feel like you forget what you're supposed to be doing.
no, I mean my mom would probably say different, but she's always nagging me about stuff. So it's not that I don't forget to do it. It's just that like after hearing her nag so much, I kind of don't want to do it anymore because she's got on my nerves.
Okay. Okay. I understand. Okay. Do your family or friends ever tell you that you should cut back on your drug use?
My friends, not really because they're doing it too. My
Right.
mom definitely wants me to stop. Like I said, she gives me like drug tests randomly here
Okay.
and there, but um not really. Like my sister, I have a younger sister and she's like 11 and she doesn't really care about it, and pretty much it's just my mom that's always complaining about it, honestly.
Okay. Okay. So not your friends, but your family. Okay. All right. Have you ever gotten into trouble while you were using alcohol or drugs?
I did get caught vaping in my science class last school year. Um
Oh, okay. Okay.
and I got in trouble for that at school and like at home with my mom. Obviously, she wasn't happy about it. Um And then I get in trouble, like, when my mom catches me, like, vaping or when she finds, like, my vape pen because then she knows that I was smoking. So I get in trouble like that, but I haven't, like, done anything specifically while under the influence besides for vaping in class.
Okay. I see. All right. Okay. Miss Gail, according to our results from sorry, my phone just went a little weird on me. According to the results of our screening tools, we probably will need some further assessment so that we can help you the best that to our abilities. But we'll get to that at a later time. But I just have a couple other few questions that I want to ask you, if you don't mind. Do you have just a
Yeah.
few more moments?
Yeah, that's fine.
Okay. All right. So, do you think there are any things in your life that you would like to change right now? How are things going?
Well, my mom's really annoying and she just nags all day and we're not really close. Sometimes I do like get physical with her when she like gets on my nerves because like sometimes she just doesn't shut up, and I'm
Oh,
sometimes like it's really hard for me to like get up right when she wants me to because like I
okay.
have depression and sometimes I just rather like sit in my room and be alone, but she's like always wanting me to do something, and so we don't
Okay.
really get along that well.
Okay. Well, maybe we
um
can. work on that. We can work on helping you with that. One
Okay.
real other quick question, and then we'll move on, and we'll move forward and see what we can do for you. But on a scale from 1 to 10, how important is the use of marijuana to you? How important is it to you?
With like 10 being like very important.
Yes, 10 being most important.
Um, I will probably put it at like a 7 or an
Okay.
8 because it really helps with my depression.
Okay, and your anxiety. Okay, very good. All right, Miss Gail. For now, that's is really all we really needed to accomplish today. But
Okay.
we will further this up with some assessment, and we'll move on from there.
All right. Thank you.
Thank you.
Okay.
Okay, I
And
think
then
that's all we need to do for now, right?
yeah, just make sure you hit stop recording.
Okay, let me do that right now. Okay. Yes.